My name's John McFarlane and I'm a urologist, and urology is the specialty that looks at diseases from the urinary tract, so the kidneys, the bladder, and then in men particularly the prostate, which causes a lot of problems as men get older. So that's the sort of area that I specialise in and treat people for. There's a lot of things. Some of the conditions we see are relatively straightforward. We see a lot of people with problems with infections, for example, and kidney stones, and some people have problems with their bladder function. And then there are some more serious conditions like prostate cancer, kidney cancer, bladder cancer that we have to look after as well. A lot of the people we see are men because of the nature of urology, and a lot of men over the age of 45, 50 start developing some problems with their waterworks, sort of trouble going to the toilet, getting up at night, things like that. And often that has a relatively straightforward and a simple reason for it that we can fix, but it's something that we need to just check out and get to the bottom of because occasionally it can have a more serious cause. A lot of the conditions we treat can be managed with lifestyle changes, just simple things that you can change in your diet or your fluid intake or the way you live your life. Sometimes it needs drug treatment, and other times we can offer surgical fixes for certain conditions. I guess most patients are referred by their GP, and we see them here in the outpatient clinic. These days we're doing a lot of consultations by video after the COVID-19 pandemic, and that's often a good way of getting an introductory idea of what the problem is and how we might help it. And then typically after that initial assessment we go on to do some diagnostic tests. That might be scans or blood tests, occasionally endoscopic examinations, so where we put a telescope inside the body to have a look inside. And then typically once we've made a diagnosis we'll proceed on to treatment. Sometimes the treatment's very straightforward and we can initiate that through the GP. Sometimes it's a bit more complex and it has to be done here at the clinic. I like working at the Bath Clinic. The staff are very dedicated and experienced and good at their jobs. It's a comfortable, welcoming place. It has a nice atmosphere, and it's just a nice place to work. Well, why did I get into urology? Well, I was lucky enough to work in one of the centres of excellence for urology, the Institute of Urology in London, with a lot of world experts, and they sort of ignited my interest, if you like, and it was a great place to work, and that's where I decided to stop specialising in urology.